Hey guys, it's Kelby Hightower with Medicare Monday for seniors. Hope you guys are doing well. Medicare Monday for seniors is all about making your life easy by making Medicare simple. We would want to invite you guys to be able to follow us on Facebook and also subscribe or follow our content that's on YouTube. It'll actually allow you to basically take the bite-sized information we provide you on Medicare Mondays and actually go to our YouTube channel and actually get a deep dive into any content that we typically will cover on Medicare Mondays. So if you guys are kind of like to get educated before you make a decision and you want to be able to build a relationship with an agency, we're here to basically educate you on the basis of allowing you to watch, listen, and then really giving us a call and allowing us to guide you through the health plan options as you begin to choose that option. But you may want to gather information and do your own self-study, and obviously Medicare Mondays are designed to do that, and also our YouTube channel is there to provide you that content as well. So we encourage you guys to be able to like and share that as you're walking through some of the information provided to you. So over the next few weeks, we're going to be talking about the different health plan options: Medicare Advantage, next week Medicare supplements, and then prescription drug plans. So we want to go over really kind of the pros and the cons of Medicare Advantage and the pros and cons of Medicare supplements with you, and this week talk about Medicare Advantage. One of the reasons a lot of our clients that are enrolled into Medicare Advantage plans, and we live in Tennessee, so there's a huge amount of plans. There's a lot of metro areas, but in comparison to maybe like Kentucky, where it's more of a rural market, you have Lexington or Louisville, Kentucky, and outside of that, most of the cities are smaller. We live in Clarksville, Tennessee. It's considered a small urban city, but you have Nashville that's 30 minutes away. You have Knoxville, Chattanooga, Memphis. You have some large metropolitan or mid-sized metropolitan areas. And typically when you have a state like that, you have a large option of Medicare Advantage plans. So our clients that are in the Tennessee market a lot of times choose to go on a Medicare Advantage plan because, one, they're normally a zero premium or very low premium. So all of our clients are on zero premium plans. It also provides the controlling of cost or copays in comparison to Medicare Part A and Part B services. So original Medicare, you have deductibles and coinsurance of 20% for billable items for Part A and Part B services. Our deep dive that we do for Medicare Made Simple on YouTube can allow you to be able to kind of understand that a little bit more in depth. But to keep it simple for you guys, if you stay on original Medicare, your exposure out of pocket can be several thousands of dollars every year, or you could go into a hospital situation and have multiple specialists work on you and come out with thousands and thousands of dollars. So Medicare Advantage plans have max out of pockets. So their plans are based on basically either $6,700 or up to like $7,500 now of max out of pocket. So the most you can pay in a given year is going to be up to that max out of pocket. Where on a Medicare, the sky's the limit. If they bill, you have to pay. So a lot of our clients that don't want to have an additional premium plan, like a Medicare supplement, they want a zero premium. They want the flexibility of knowing that they can get additional benefits like Medicare Advantage plans will provide, like dental, hearing and vision, ancillary products like transportation, food benefits. Now they have like flex cards that you can use for dental, hearing and vision, or they'll have a food card that you can buy healthy choice foods every month, sometimes $50 or $100 a month of additional food that you can intake into your home at no cost to you based on the plan need. But that person is still willing to take the risk of paying some small copays when they do go to the doctor or hospital. And they also know that they're insured beyond that catastrophic situation where they pay up to the out-of-pocket maximum. And beyond that, the plan picks up everything 100%. So you have a private insurance company that's contracted with Medicare. Medicare pays that private insurance company to administrate all your benefits for your Part A, Part C, and then also typically most of those plans have the Part D, the prescription drug plan, built in. That makes them what they call a MAPD, a Medicare Advantage prescription drug plan. So that is one of the big takeaways on the pros. The cons is a lot of times you're in an area where there's not a big network of doctors. Now we live in an area where there's a huge metropolitan city, and because of that there's a huge number of primary care doctors, specialists, and access to hospitals. So here in Clarksville and connected to Nashville, our clients can go into a Medicare Advantage plan and have access to hundreds and hundreds of doctors. But if you're in a rural area or an area where the network of doctors and hospitals are more limited, or you live on a state boundary where it's like Kentucky, Tennessee, and you're living in Kentucky and you're traveling to Tennessee to get your care, we would typically say there's going to be a network issue or an out-of-network cost on Medicare Advantage plans, and it's just going to be too high to be on a Medicare Advantage plan. That's where we would guide our clients to a Medicare supplement. The other thing is the risk of max out of pocket. You know what? You may say, I don't want to have the risk of paying up to $5,900, $6,700 out of pocket for my cost share amounts. Basically, if your copay for a hospitalization is $300 and you stay in the hospital for 3 days, you owe $900 on the Medicare Advantage plan. That goes toward your max out of pocket. So if it's $5,900, you take $5,900 minus $900 that you paid, and your max out of pocket for the rest of the year is still $5,000. But sometimes people say, I don't want to have having to pay out of my pocket up to that amount. So that is one of the reasons people choose a Medicare supplement plan. And then some of the other things that are really the major kind of downfalls with Medicare Advantage plans are sometimes when going to get surgeries and procedures, you'll go through the doctor will do what's called a prior authorization with the plan. Now, plans historically 10 years ago, this was a major hurdle. Now, a lot of times those plans, some of the plans in our markets have the ability, the plan chooses with the doctor to allow the doctor to be empowered to determine on small procedures, surgeries, to have it done and not have the prior authorizations. But when going into like physical therapy, there's authorizations. When going into skilled rehab and how many days you're going to stay there, there's going to be authorizations. The doctors are going to drive how many days you need to be there. And then once that day comes that the plan says, hey, you've done your rehab, it's time to go home, you may not be at a place where you can go home yet. So what happens is the doctor has to do an authorization again to keep you in there. Well, that can be frustrating because original Medicare works a little bit different. And we'll go over some of the benefits next week of the Medicare supplements in conjunction with how the Medicare Advantage. So that's kind of pros and cons on a Medicare Advantage plan. And you may say by the end of the second week, okay, I'm still confused. What do I need to do? That's where you would call us. We can do an assessment for you and actually walk you through your different options and really just take an honest review of what your situation is and then provide you guidance on what we would suggest for you based on the area and the plans available for you in your market. Guys, until next time, have a great week. We'll see you again next week on Monday. Thanks a lot.